Now, as I mentioned, the Joanna Briggs Institute, the collaboration, we really are a global collaboration. And I just want to go into, as I said, these are some of the learnings from what we've been doing over the last 17 or 18 years, and working with these people all over the world. And the way we work in Adelaide and the way all of our collaborating centres work around the world is really quite similar. And it really hinges on collaboration. It hinges on partnership, it hinges on collaboration and partnership with clinicians and researchers, and really getting that one world to meet the other. So we don't just sit back in our home at our desks in Adelaide and decide what do these people need to know about. In many cases, yes, we do push knowledge out through all of our systems, but the way that knowledge is born, or where it comes from, is really those clinicians coming to us and saying, this is what we need to know, this is what we're doing, are we doing it the way we should be, what can you tell us about how we can be doing it better, are there better ways of doing this? So they're really pulling at us to say, this is what we need to know about. And that really facilitates exchange between both groups. So throughout this collaboration around the world, these real questions are arising in active collaboration, and we're providing really practical, we think, answers. These are the sort of things that clinicians want to know. And I just want to give you an example, as I mentioned, a little evidence journey of what's occurred in Adelaide. And obviously the Royal Adelaide Hospital, who we work very close with, they're our clinical partners, and many of our centres around the world have clinical partners they work in directly and have similar sort of interaction to what I'm going to describe to you here. In this case, it's a really nice story. A group of clinicians, these are nurse leaders across all different services within the hospital, so internal medicine, cardiovascular and cancer services, even general surgery, got together with a senior dietitian at the hospital because they realised that malnutrition, particularly in the elderly, was a big issue. Not necessarily what we call a fancy or a sexy issue, but it really was an important big issue, and they were having real trouble in the hospital related to it. We know that 40% of elderly people admitted to hospital arrive in a malnourished state, and 60% of them are unable to maintain their nutritional status while they're in hospital. And bear in mind that in large public hospitals like the Royal Adelaide Hospital, these elderly people make up a large number of the people who actually admitted on a day-to-day basis. So they decided, what can we do? We know we're not doing things right, and one of the first things they focused in on was the fact that they weren't doing risk assessments correctly. So they designed an audit topic. So this is right in that red wedge that you saw just a slide or two ago, about getting evidence into practice. And they decided to conduct a clinical audit about related to malnutrition amongst elderly in an acute care tertiary setting, and focusing in on how risk assessment was being conducted. And the aim of this evidence audit was really quite simple, it was just focusing on improving nursing nutrition documentation for elderly patients identified as being at risk, and also to ensure that elderly patients identified had appropriate nutrition care plans actioned following that identification. So what do we mean by a clinical audit? Well, the first step in the process is to turn to the evidence and say, what does the evidence say should be occurring in this case? In essence, that becomes the benchmark to which their processes are then measured against. And this was conducted across 5 wards in the Royal Adelaide Hospital, and they had 3 simple criteria using the JBI PACES, the Practical Application of Clinical Evidence System, which really is a system that's designed to facilitate the conduct of an evidence-based audit. And they had 3 simple criteria around screening and risk assessment of patients, elderly patients at risk of malnutrition. And here you can see the system really is designed to help across the tabs across the top here to set up a clinical audit, can help with the sampling, the data collection, and here on this screen we have an example of a compliance report. Now it's hard to see here, and these are the actual data that they came up with this team working in the Royal Adelaide Hospital, who turned around and said, we know we have a problem here, we want to do something about it. In other words, they're the champions behind this, they're the leaders behind this. How can we do this, and do this in a systematic sort of way, a systematic evaluation of the process and what they do in healthcare. So they did baseline audit. Now you can't really see it, but the second bar will help. And then the gold line, you can see for the number 23, the second audit criteria, appropriate action plans are initiated when at-risk patients for malnutrition are identified. And that only occurred in 23% of their cases across the 5 wards. And you can see the first 2 criteria about using a validated tool and patients are being screened using a validated tool, there was no compliance at all when they started this. But through then moving on to what we call the GRIP cycle, and this is getting research into practice, and this is really based around action research, the team and all the people that they get involved identify what the barriers are. Why aren't we doing this properly? What's missing? What do we need to be able to do this properly? And they start enacting some of that. And here you can see when they did the audit after that, and there were some simple things, I don't recall them all, but they found a validated tool, they developed a proper nutrition reporting chart, and they made sure that nutritional fluids are always available and handy for the nurses to get their hands on to provide for the patients. And also they did a whole series, I think over the course of a 3-week period, something like 120 nurses were educated in the use of these tools and what was becoming available to facilitate this risk assessment process in care. And what they found was when they audited soon after that, that they were up around 70%. So there's a real change in practice by clinicians who've turned around and said, how do we do this? How can we do this? How can we improve our care? And this is how the tools, a tool like this, in terms of getting evidence into practice, can help. Now this story is a really nice one because it doesn't just stop there. Through this process and really embracing evidence-based practice and the impact and how it can help decision making, change process and the like, the senior dietitian involved in this said, well, I'd like to do more. And she really took on that role as a leader. And what more did she do? Well, she had a question of her own. And so she came as a clinician looking to do some research. And the research was a systematic review, and I worked very closely with her on this, but it's about the effectiveness of mealtime interventions to improve nutritional intake of adult patients in the acute care setting. And there are numerous examples of this, and then we work closely with the librarians as well as researchers, systematic reviewers. You know, searching is so important, and it really does promote how information and information specialists and clinicians and researchers can all come together to bring this around full circle and really improve outcomes. But this story is really typical of how the sort of research that we do, the work that we do at the Joanna Briggs Institute, is driven by what's going in the research setting. Similarly, those evidence summaries, for example, that I mentioned that provide those snapshots for clinicians, well, if you get into your resource at JBI at Ovid, you'll see there that there's the opportunity to request a particular evidence summary if you go into the database and you can't actually find what it is you're looking for.